Hello everyone, I am Dr. Pawan Poddar, consultant cardiologist at Yashoda Hospital, Malakpet. Today I am going to talk about atrial septal defect or ASD. ASD is a common acyanotic congenital heart disease. It is present right from the time of the birth. It is an abnormal communication between the right and the left atrium. Most of the time ASD remains asymptomatic in childhood unless it is very large. In other cases, most of the time it will present with symptoms after the second decade. Most of the time patients will be in the 30s or 40s, and the most common symptom will be breathlessness on exertion. While walking, patient will feel breathless. Sometimes they may present with features of right heart failure, that is they may have swelling in the feet, they may have right upper abdominal pain because of enlarged liver. So these are the most common symptoms of ASD. Many times ASD can be picked up by the pediatrician when they examine the child with the stethoscope. They will hear some abnormal sound called as the murmur. They will hear the fixed and wide splitting of the second heart sound. So this will be picked up in children. But sometimes in adults for evaluation for breathlessness also we can detect this disease. The diagnosis is mainly confirmed by 2D echocardiogram where we can assess the size of the defect, and we can assess the dilatation of the right side of the heart chambers. And most of the time the defect requires either surgical correction or it requires closure by the device. The defects which are central in location, they can be most of the times can be closed with a device closure without open heart surgery. It can be done from the right or the left groin, and the procedure is very simple. It can be done within half an hour. And most of the time while doing the procedure we will be doing it through transesophageal echocardiogram, which is nothing but kind of echo test where a pipe is put in your esophagus, and during the procedure the deployment of the device and the correct position of the device is monitored through the transesophageal echocardiogram. The defects which are not central in location or which are very large, those defects needs to be corrected by surgical closure. So here the chest will be opened through a median sternotomy, and the defect will be closed after putting the patient on the bypass machine with a pericardial patch. Once the surgery is done or the defect is closed by the device closure, the patient can lead a normal life, and the life expectancy is normal in most of these patients.
Like, comment, and subscribe for more health updates.